Thank you, Mr. Vice President. And it's really a moment that we want to call on every American to increase their vigilance. And I want to go through some data about why we are asking people from Elko, Nevada, through Denver, Colorado, to Philadelphia, from Madison, Wisconsin, to El Paso, Texas, and across this great nation to really increase their vigilance at this moment. I want to thank the governors and mayors and county commissioners that I've had the privilege to talk to over the last 4.5 months of being on the road. We can have the first slide, please. The number of universities, 42 states, 30 universities, and a large number of chairmen from our tribal nations. The reason we wanted to really be and hear is to really understand the reality on the ground, what they were facing, and understand how we could be more supportive. And this is really a call to action for every American to increase their vigilance because of the graphic that is shown here. I wanted to show you the difference in slopes between the spring surge, the summer surge, and the fall surge. So the American people know that this is more cases more rapidly than what we had seen before. But to also make it clear, like before, we do know what to do. And we're asking every American to do those things today. The next slide shows our increase in test positivity. The light brown bars are the number of tests that were performed. But even with the number and ever increasing number of tests performed, you can see the increase in test positivity to around 10%. In some areas of the country, it is much higher than that. And it illustrates the ongoing community spread in your counties, in your small and large metros, and in your rural areas. The next slide really shows the country as a whole and why we're asking every American to remain vigilant, to do those things that we have been asking you all to do, to wear a mask, to physically distance, to continue your hand hygiene, but really in this moment of bringing people together, to really limit interactions indoors to immediate households when we see this level of community spread. Behind this level of community spread is a lot of asymptomatic cases. People are spreading the virus because they don't know they're infected with the virus. And so people are coming together indoors. Everyone looks healthy, but among those individuals could be individuals that already are infected, have no symptoms, and are unknowingly spreading the virus to others. It is because of this asymptomatic spread that we have asked people to wear masks indoors and to ask people to wear masks when among others. But sometimes when we go indoors and we're with friends and family, we just assume that if you look okay, you are okay. And now we know that over 50% of the individuals, particularly among those under 35, many could be infected and unknowingly spreading the virus. This virus increased so rapidly because there was an unusual cold snap that began in the northern plains and went down through the heartland, where in the end of September, beginning October, a large number of people moved indoors. So we've been going across the country to really tell the mid-Atlantic states and the Northeast to really increase testing, looking for these asymptomatic cases. And I really want to thank the governors across this great land who have really heeded that call and set up what we call sentinel populations, whether it's nursing home staff, K through 12 teachers, whether it's community college students, county workers, specific businesses, to really have routine weekly testing so that we can see the spread of this virus down to the zip code and really combat that with additional mitigation.